struggle at this point of uncertainty. In the seconds that follow the initial start of their painful experience, uncertainty fills their mind. And it doesn't necessarily manifest as specifically uncertainty, but this is the uncertainty that they don't know is it actual or potential damage that they're experiencing. So what do they do? And I think we have a brain. I think we have a biological program for a couple of specific behaviors that we do. And one specific one is we look outward. We look outward to the world to help us answer this question, the context that we're in. But everything in the context surrounding us is not equal. Certain things are more salient to us than others. From an evolutionary, or at least an anthropological perspective, there's been individuals in our lives that we've always tried to pay attention to more so than other people. These people, before medicine was as powerful as it is today, had a certain role in society, in cultures and groups. These shaman, these medicine men, they helped individuals wrestle with the uncertainty of the experiences they dealt with. They helped give them labels. They helped ascribe meaning to these things. From a developmental standpoint, when the first time a child was running, a toddler is running, and scrapes his knees, falls, trips, and scrapes his knees, does he cry immediately? Right, they look. They look to their mothers and fathers. They look at them. And it's based on the reaction that's coming back that they get an appraisal of themselves. They're looking outward to find out what's going on inward. And these are the symbols associated with the people like us in this room that people are going to when they're trying to resolve this sort of uncertainty. And so this is kind of the heart of the questioning that goes on in our patient's brain. And it gets exhibited in their behavior. So how do we plot a course through this uncertainty, from this uncertain starting point to a certain end point? Obviously, the alleviation of pain has been one thing we've focused on, but how do we get through this? The challenge is that uncertainty is aversive. It's both aversive for the patient. They don't want anything to do with it a lot of times. And we sometimes don't want anything to do with it. And that's the challenge. We want to see them get better. And when they're not getting better, that's sort of aversive for us as well. And a lot of the patients that I've worked with in the previous talk, sometimes there's not a clear roadmap. There's not a protocol that we can follow. There's not necessarily a specific set of interventions for this specific person at this specific time. So how do we figure this out together with the patient? How do we answer this question of uncertainty? And that's really where we're going. So I think let's put ourselves back into our patient's brain and think about, in addition to when they come to you and they're saying their pain's at 8 out of 10, it's in their neck and it hurts all the time, what are some of the things that come along with this expression of pain? These may not always come out all the time. They may not always be right there on the surface, but questions like, will I lose my job? Will my partner still love me? Can I still be as active as I once was? These are some of the questions I think that are just lying just beyond our patient's expression of pain. And how do we decode this? Because it's difficult to answer these questions. I think sometimes as clinicians we can feel somewhat uncomfortable when these things really come out in their strong form. So how do we answer this question? Well, I think it starts with peeling back the layers and looking at the basic root of all these questions. And it starts with this simple question: am I all right? I think that's a fundamental part of all those bigger questions. And how do we answer that? Well, I think that's what our training is designed to answer. And we really embodying that answer and really respecting what we know and what we don't know is huge. And we've heard from multiple people earlier today trying to, or throughout this entire conference, answer this question through different modalities, through touch, through the use of movement. But it's really this fundamental question.